Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
other radiological things. Mammography. In the mammography will actually deliver a radiation. It delivers a radiation dose of more than a chest X-ray. Sorry, yeah, more than a chest X-ray. So it delivers a radiation dose of 0.1 C Guy per study. So this is almost more than chest X-ray, whereas chest X-ray will only deliver 25% of this dose. So on screening mammography, there is no increased risk of breast cancer is not seen with screening mammography. Mammography is mainly used to detect the unexpected breast cancer in asymptomatic women. That is, it is used in screening of the breast cancer, which is nothing but screening. Then there are two views of mammography. We have two views in the mammography. So we have mediolateral oblique view is present, and this mediolateral oblique view will see that in mediolateral oblique view we will see that there is greatest volume of the breast tissue is seen in the mediolateral oblique view, and you will also see that there is upper it shows upper outer quadrant mainly along with the axillary tail of Spence also. Then the second is we have craniocaudal view. Craniocaudal view will mainly provide the visualization of medial aspect of the breast can be visualized, and this craniocaudal view will tell us about the breast compression. It shows greater breast compression. It shows greater breast compression. Then we have mammography is mainly used. The uses of mammography, it is used to guide the interventional procedure. So with the interventional procedures can be done with the help of a mammography, like we can do a needle localization is done with the help of mammography, and needle biopsy is also indicated in the presence of mammography. The sensitivity of mammography is actually reduced in younger breasts, because in younger children, in younger patients, the breasts are dense. So as a result, the mammography will not give proper reading. So as a result, it is not indicated in patients who are less than 35 years of age. Then what are the mammographic features which are suggestive of breast cancer? So mammographic features which are suggestive of breast cancer are: first, a solid mass may be seen with or without stellate margins. There may be solid mass with or without stellate features. Asymmetrical thickening of breast tissue is seen, with clustered microcalcifications are seen. So one we see a solid mass is seen with or without stellate features. Then we have asymmetrical thickening. One we have solid mass is seen with or without stellate features. Second, asymmetrical thickening of the breast tissue is seen, and we see presence of clustered microcalcifications are seen. So these are the mammographic features which are suggestive of breast carcinoma. And in the breast cancer, you will see presence of fine stippled calcium is seen in a suspected lesion. If fine speckled calcium is seen in suspicious lesion, then it is suggestive of breast cancer. and it is seen in almost 50% of non-palpable cancers will report this fine stippled calcium in a suspicious lesion. Thus, we can say that the microcalcifications are the important sign in breast cancer in younger women, in breast cancer detection in younger women. Now, what are the advantages of the breast cancer? Sorry, advantages of mammography. Then, mammography will cause 33% reduction in mortality after screening mammography. It causes 33% reduction of mortality by detecting the breast cancers earlier. Mammography is more accurate than clinical examination for detection of early breast cancers. And this will provide a true positive rate of around 90%. Then, when do you screen? Screening is done at the starting. We should start the screening at the age of 40 years of age, and then the breast examination is done yearly, and a mammogram is also done yearly, and we take yearly mammogram are taken is taken sorry yearly mammogram is taken. Mammography helps in 40% reduction in stage 2, 3 and stage 4 cancers, and with overall that it also causes 30% increase in overall survival also.
Thank you and thank you for watching.